Hi, everyone. Good evening. A very good evening to all of you. So we are here for the session, Decoding Diabetes. That is the practical nutrition hacks for busy professionals. Okay. So here with me is SMY Mishra. She is one of India's most celebrated clinical registered nutritionists and diabetes educators. So she has over 16 years of experience in transforming lives. She is, the founder of FitGenics, award-winning expert in Foxclue's Top 100 Under 40 Award, Remarkable Women's Award, Fascia Superwoman Award, among others. She's a prolific health writer, speaker, and media contributor. She's deeply passionate about workplace wellness and helping people achieve a balance between professional success and health. And she's additionally certified in mental wellness. She integrates physical and emotional health for a holistic approach. Smriti, over to you. I mean, your awards are saying a lot of things, but I'll still get it to you. You can, take it forward. You are on mute, Smriti. Just unmute.
Yeah. Thank you, Anamika. That was quite comprehensive. And I once again welcome all of you. And today's topic is actually very one of the relevant topic. And I thank Team IMT Care, who always think about the relevant topics and the topics that are the need of today's schedule, today's toughest life schedule. So in today's topic, decoding diabetes, I will be showing you some practical but sustainable nutrition hacks that you can follow today to build a happier future tomorrow. Okay. So I won't waste much of your time and directly start with what is diabetes very shortly. Before that, what I will be covering in my presentation, a quick overview for all of you. First, we all know that tackling nutrition challenge on day-to-day basis for diabetes is really something, a topic that we think, but actually not able to or not give our 100% to follow or to, overcome the challenge, how to overcome these challenges, because we know we all are working, we have a very tough schedule. So to balance work and life, how you can bring the best but practical strategy with which you can go ahead every day with a thought that, okay, I will balance my nutrition, I will balance my good health for today, and also to maintain that for, a healthy tomorrow. And I will be covering some time-saving meal preparation strategies, because I know that when we just start our day, when we just start our week, it's a very difficult to, organize all the things. And you do not think of what you are going to pack for the, lunch or your breakfast you pack if you're working on morning hours. But you only think about, yes, you have to go to workplace, you have to catch your commuting medium, whatever you whatever medium you take to reach office. So only thing that hits your mind is, yes, I have to reach office. So in that very little time, how you can strategize your whole day, that is my focus today. So about mindful eating, and also how you can leverage technology, because for every day to day we use mobile phones every day. Mobile is so handy. We done our more than 80% of work through mobiles. But how to leverage that tactfully, for your good health, that also I will be covering. And also I'll include some tips for your mindful eating with some stress management tools. I'll just start with your first slide, and I'll cover all the points that I had mentioned. So diabetes mellitus actually is the combination of Greek word and a Latin word. So the Greek word diabetes, that is actually it's a spot that means passing through, and mellitus is a Latin word that means the honey or the sweetness it has. So when the excess of sugar passes through the urine, that symptoms lead to known as this disease, diabetes mellitus. So this is a disorder in which you either produce very less or almost no insulin in your body. That is what it is being categorized as diabetes, type 1 diabetes and type 2 diabetes. See, here I have mentioned 3 important types, and one is what we mostly see on the internet, and most of the people come and ask me, what is this MODY, what is this LADA? So see, the American Diabetes Association and the International Diabetes Federation, these are the governing authority who has defined 3 major types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. So type 1 is when there is no insulin production and you will be, or the diabetic patient will be on lifelong insulin. Okay. There is no, escape. You have to take insulin. That is what it helps you to, maintain your sugar level. And the second category is type 2 diabetes, that is insulin dependent, insulin resistance, and when your body is not producing enough insulin. And this type 2 diabetes is directly linked with your lifestyle factors. That is why it is called lifestyle disorder. But the good thing is it is managed or reversed. You have come across several stories where you have heard about that. Oh, diabetes is reversal. Yes, it is. But how it can be a reversal program, that I'll let you know later through my slides. The third category is gestational diabetes. So this is basically when the pregnant women develops this type of diabetes. This is called gestational diabetes, or shortly we say GDM. This can be resolved post-childbirth, but with strong monitoring, with the help of your diabetes educator, with your physician or dietitians. The lady should be, again, on strict diet and some exercise. Exercise is not post-pregnancy. After your lactation period is over, the exercise is recommended. And before that, what kind of stretching and all you can done, that is best guided by the healthcare providers. Okay, so these are the 3 major types of diabetes. Now, over the internet, you can find or you can come across this terms MODY. This is the maturity onset diabetes of the young. And this is basically a genetic disorder. And LADA is mostly seen in the adult. And this is also a kind of very slow progressive type 1 diabetes mellitus. Other types you may come across on the internet is type 7, type 9, type 15. But all these types have no scientific backing. So the governing bodies do not authorize this kind of topics, or these are not the valid, category. So these type 1, type 2, type 3, these are the actual types of diabetes mellitus. Now coming to the statistic point, presently, if we see the prevalence part, global impact is 537 million adults worldwide are struggling with diabetes. And this data has been given by International Diabetes Federation in 2023. And India's burden, if we look at the India's burden, why India is called the diabetic capital, it is because more than 90 million Indians are living with diabetes. And it is expected to reach 151 million by 2045. So yes, it is a rising concern, and this it is rising concern, and this prevalence is showing that how this is linked to our dietary habits, our the food, the nutrition literature, the right information, our lifestyle. What is our lifestyle presently? Because of the work hassle also, and we are next to China. China is 116 million, and we are 90 million. We are not taking any pride in saying that we are next to China in diabetes. We want to go just down, okay? And to add further, 69 million Indians are undiagnosed. They are not aware. So you can put them also in this same India's burden category, okay? Now the impact is all known, especially though those who are diabetic, they have come across the disease or the disorder associated with this lifestyle disorder. Like in future, if their diabetes is not controlled, if they are not very aware, if they are not conscious how to maintain their blood sugar, that may link to the other organ failure like heart failure, kidney failure, and the eyes is directly damaging. So there are many cases too. And of course, the economic burden. It is the direct healthcare cost and the productivity loss. If in a company of 1,000 employees, if say 200 or 300 people has, they come up with this disorder, this lifestyle disorder, what will happen? It is the loss of company. It is the loss of company. It's not only the loss of that particular individual, it is the loss of the company. So overall productivity loss is there. So yes, it is the one of the economic burden. This is one of the key statistics. Now, how to tackle nutrition challenges in our busy lifestyle? This slide is very important. I just want to give full attention to understand few terms that you need to you need to just apply in your day-to-day level. Now, when I say if some person has now recently gone diagnosed as a diabetic patient or diabetic person, now what the person will do? First thing, the stress level goes very high. So it happens that a person detected with diabetes and there is no history of diabetes in his family, then the person will be so much in stress, and the person will think that, oh my God, now it is not treatable, and how it happens that why me phase is so long that you will be, end up with inviting more of the disease, that is the stress-led diseases. So I will share few terms that I really want you to understand and share with others also who is recently diabetic, who is overweight, because overweight persons are more prone to get diabetic. This is backed by research. And whatever I'm saying, whatever else I'm speaking, these are not my lines. This is something what research say, the studies has been done, and what the governing bodies come up with all these research studies. So the first thing that I'll be talking about, the medical nutrition therapy. Like how you go for a medicine therapy, you go to a doctor will prescribe the medicine, and you think that, okay, now I get the, okay, somebody has raised hand. Whatever your question is, I'll answer later after this presentation. So let me finish this presentation first, then I'll take your questions. And also, I will be answering if you can email me all the questions after the presentation till 7 days. After 7 days also, I'll answer all the questions. So don't worry for your confusions or your questions in your mind. First, understand all these terms very quickly. I'll just finish all these things. Okay. So first is the role of nutrition therapy, just that I was discussing. Like medicine therapy, the nutrition is also a kind of therapy now. That is why it is called medical nutrition therapy, and we are called as we are clinically monitoring your sugar levels or your lifestyle management we do. So we call it as a medical nutrition therapy. It's a therapy. So first thing, glycemic control is very important. Now, what is glycemic control? I'll explain it in my later slides. And this glycemic, once you control your sugar level, that is the glycemic control, it will further reduce your HbA1c. HbA1c levels are the average level of sugar over the 3 months of period of time. So when we do this test, HbA1c, a person is detected highly diabetic or borderline diabetic or prone to diabetic. So when you start taking medical nutrition therapy, it will help control your sugar level, and it will help in reducing your HbA1c levels. And the research says that it helps HbA1c down by 2% in type 2 diabetes. And that's a very, very, very good result. Okay. Okay, and also after medical nutrition therapy, you just think about it. Okay, how nutrition is so important because it is helping in reducing your overall sugar level and average of HbA1c down by 2%. Also, it helps in your once HbA1c lowers your cholesterol level, blood pressure. If the person has this associated markers, this will also come down. And this is since I had already I had told you about this. This is directly related to the other organs system. So it helps in reducing the risk of your kidney diseases or some kidney issues or the heart diseases and other lifestyle disorders. Okay, and for this, tackling these challenges, what are the barriers? The barriers, the first and the foremost reason is your time constraint. You don't have time. Everyone is saying like that, I don't have time. See, boss, time is limited, and that is for everyone. Even if the person is saying, I don't do anything, he or she has also the limited time, and that need to be, uh, it depends on the person how you are utilizing your time. But especially for diabetic patient, you should be, very informative. You should make informed choices. And if you are still have very limited access to healthy meals, you should think about it. Because I have come across many of the persons when I take session physically, when I go to the workplace, their employees say we have no access of healthy food meals. Whatever food is present in the canteen, we go, we eat. Come, what to do? We don't have time. But you can manage your time. You have to pre-decide things. You have to strategize how you will make the strategy, how you make strategy in your work. Similarly, you can make strategy for your food, right? So practical nutrition strategy, with the help of this, you can easily maintain your sugar level. And once you maintain your sugar level, you will able to maintain your weight also. Even if you are, overweight, or even if you are maintaining your good BMI, that is body mass index, you will maintain that. There would no any fear that today you are maintaining, you don't know about tomorrow. If you strategize what is your how your food will be for a month or for even for a shorter time, for this week, for another week, you have to think in advance and prioritize your health. Okay. Are you able to see the slides? Okay. Now, the one thing that is very important in the slide is carbs distribution. What people mostly think that um, now I am being diagnosed as a diabetic. Now I don't have to eat carbs. So the unknowingly or unintentionally, people just start following low carbs, very low carbs diet, and that is also not advisable. See, what happens is even if you are you fall under type 1 diabetes mellitus who are insulin dependent, they have to take insulin. They need to follow the carbs and insulin ratio. So for example, for type 1 diabetes mellitus, this formula works. 1 unit of insulin, that means you at least need 15 grams of carbs. So the one who are using insulin, they are very smart. They eat their cheat meals and adjust the insulin accordingly. But we should avoid that. But this is the formula how you will maintain your sugar level. This is for type 1 diabetes. Now, who are type 2 diabetic, who are taking medications, they need to focus more on the complex carbs. Okay. What are the complex carbs? The complex carbohydrates are those which has high fiber, or those cereals or proteins that has husk, like we commonly call it the chilke wali dal, and the legumes like rajma, chole, chana, that has husk. Similarly, in grains also, that has husk. So brown rice, that is, that has more fiber. And the more fiber-rich food you will opt, you will get low glycemic index. This term I will describe in my later slides. And yes, the most important part is the portion control. So if you control your portion, will have low glycemic index food, and if you will focus more on the complex carbs, your sugar will be equally distributed. Your sugar will be maintained, and you are equally distributing carbs. You need carbs in entire day to maintain your sugar. It's not like that in breakfast you are having carbs, and in lunch and in dinner you will skip. If you're diabetic, you need to, you have to divide your the day hours, like breakfast, lunch, and dinner. 3 major meals you have to take, because this is a therapy. If you want to do a fasting, or if you want to do some religious fast, then also the diet is planned. So now what will happen? The nutritionist or dietitian or your diabetes educator will plan your diet accordingly, and the level of carbs that you will be required will be equally divided, so that your sugar will not that will not give a spike in your body. Okay. So this is the example that I had given. If in breakfast you want to take, how carbs is distributed in your entire days. Firstly, the your assessment will be done, and then how much calorie is required for you, that is planned. Say 1500 calories a person needs, then then 45 to 60%, depending on the person's physical activity and what kind of lifestyle the person is maintaining. Accordingly, we take the amount of carbs ratio, like 45 to 60% is the thumb of rule. This we divide, this we take 45 to 60% of the total calories. So if the total calories is 1500 kilocalorie, we are taking 60% of 1500. So it will come around 900. So accordingly, we will divide in breakfast, in lunch, in snacks, and in dinner. So this is an example that I had mentioned here. Like in breakfast, if you take 2 moong chila, that is, moong is green, not yellow one. So green is with husk. So again, you will get good fiber. Excuse me. So 2 moong chila with mint chutney, or one bowl is the standard big bowl, but not a small bowl. That much of vegetable poha if you will take, then that will give you 40 grams of carbs. Okay. And since chila is more rich in fiber, the calorie is less there. So when we calculate carbs, it will come around 35 grams. So that depends. This is the ratio I'm just giving you, just to make you understand. Okay. So this is the way you can have the carbs distribution. If you are a diabetic, you should equally divide your calories. If you will eat 2 or 3 meals, but very rich in carbs, your sugar will spike. That is quite natural. If in breakfast, if you will include more than 3 cereals, your sugars will be very high. If you will eat sandwich also, if you will eat even a bowl of oats and sandwich together, your sugar will be high. So you have to divide carbs there. So another example, if we can take for lunch or snacks or dinner. So see the example. I'm taking the example of snacks. If you are taking a handful of roasted makhana, so makhana is a very healthy again, and 15 grams of carbs you will get it from there. So person who are on insulin, 1 unit of insulin there, that person can have 1 handful of makhana. Okay. So this slide is basically to make you understand how you can equally, distribute your carbs and get tension free, that okay, your sugar will not give spike. Okay. Next. Now, how to optimize your blood sugar? There is a new research about a glucose transport protein that is known as GLUT4. GLUT4 is a protein that actually transports your blood sugar into the muscles and fat cell, which further gives you energy. And it is highly influenced by exercise, diet. If you are not doing any workout, or if you're having mindful eating, still your sugar will not be controlled. Okay, so this should be in balance: medicine, diet, and exercise. So this makes a triangle for diabetes. So we mostly counsel this triangle to all the patients. You have to take your medication and your diet mindfully and work any kind of. Now workout depends on your what is your activity level and what work you are engaged in. Accordingly, the workout is planned. Now, how you can boost glucose? See, on day-to-day basis, you don't have extra time to go through all the literature and details, but you can easily remember all these things, right? Okay, I have to maintain my sugar, so I have to balance glucose. Now, glucose is the transporter which will help in you know uh, transporting the sugar equally in the all the muscles and fat cells. So these are the sources that I have mentioned here. This will help you in monitoring, and you can, if you are insulin dependent, you can also use the same thing. Or if you comes under type 2 or gestational diabetes, you can include all these food items. So first, the fiber that I had mentioned earlier also, fiber you have to take fiber. Now from what are the good sources of fiber? All those food sources which has husk, okay, whole protein sources, beans, oats, berries, all the leafy vegetables, that comes under good fiber category. So this you can take more and often. Second is the good fat category. What are the good fat? Good fat helps in the absorption. So fats are fats are not always bad. Good fats you require. So monounsaturated fatty acid, that is good fat, and omega-3 fatty acids. These are the good fats. And what are their sources? You can include some super seeds like chia seeds, flax seeds, some nuts like walnut. Other than that, olive oil, avocado. These are the good fats you should actually include in your diet. Okay. Other category is magnesium. This is the most ignorant one. People don't know about what the magnesium role in diabetes is. So magnesium is one of the a good source of glucose. That is the transport. That is the glucose transporter. So if you include more of the nuts, seeds, sweet potato, and dark chocolates in moderation, that will again help in optimizing your blood sugar. Now people think why I should eat dark chocolate. Dark chocolates are sweet. Diabetic persons are not supposed to have sweets, but dark chocolates has those dark chocolates which has more than 70% of cocoa, that has direct impact on your blood sugar. That will help manage your blood sugar. Okay, and many of the mountains of research has been there to back this strategy that people are eating dark chocolates to maintain their blood sugar. But it is not necessary. I'm not forcing you to just eat every day. But if you will include this, this will only help. This will not cause any, or this is not a cause of concern. Okay. And sweet potato also. The name is sweet potato, but this sweet potato has low sugar, and it will give you low spike of sugar in your body. So you can easily have sweet potato. Other than that, the category comes is catechins. Catechins are very good antioxidants, and majority of the catechins are present in the green tea. There are many flavonoids also present in the green tea, and that is why green tea is recommended. You can have green tea your post lunch or even post dinner. Anytime you can, mid morning you can have green tea. So that will only boost all the flavonoids, and antioxidant will help reduce your inflammation if it is there inside your body. And of course, along with all that, good hydration and your good sleep amount, that has a major impact. So you should always take care of your body by sleeping well. And how much you sleep, we are so much addicted to phone that our sleep cycle this phone has actually led our sleep cycle disrupted. So you have to be very mindfully design your day, how much time you want to dedicate. Okay, sleep cycle you have to balance. One of the confusion among the diabetic people are, now we don't take any beverage because beverages are not good for diabetes. See, anything that is sweet is not good for you after you being detected as diabetic. But you can, if you will eat mindfully or you have a strict portion control, then it's very, it's very safe to have a beverage. Now, I never recommend beverage with only sugar, like all the colas and drinks and the sports drink. You have to be very carefully. You have to read the nutrition levels that they mention at the back of their pack. And you again have to focus on your low glycemic food. What are the choices? And always check the levels, read it. Either it is sweetened or unsweetened. Sometimes they read as a low cal or zero cal, and at the back there will be sugar mentioned. So very carefully read the nutrition information page, and always go for some nutritional boosters. Like if some beverages are with some anti-inflammatory food sources like cinnamon, ginger, haldi, these will only give you benefits. Okay, so you can consume up to 120 ml. That is a standard serving for diabetic people that you can easily take. And always try to pair this juice with a protein source or a good fat source that I had mentioned in my early slides. What are the protein source? Any low fat milk or milk products, dairy products, low fat dairy products, or good fat source like omega-3 fatty acids or monounsaturated fatty acids that I had mentioned in my early slides. These you can take. These are some popular uh, ones. These are some popular juices recipe if you want, because this is a myth that now you are diabetic, now you cannot have juice. You may have, but in a very strict portion control size. Okay, so these are the carrot orange. You can easily make at home. Avoid eating it from the market. Just prepare at home. Okay, the green detox you can easily prepare. This is the berries last. The seasonal berries are available in the market. You can make it easily. Make a small portion. Okay, and then you can have it. Okay. Now, what is the smart meal preparation? Now, if I say what should be your plate look like, how it should look like. If I'm a normal healthy person, I don't have any disorder, I don't mind eating anything, but when you are diabetic, when you are having medication, and you are little aware about the mindful nutrition, then what should be the good plate composition? You should fill half of your plate with non-starchy vegetable that we always mention. Always start with the salad. Always start with your raw vegetable if you are eating in salad form, or boiled vegetable. Sometimes boiled vegetable we put in salad. So always start with your salad, and then you equally divide your protein or carbs. Okay, or if you are taking only one carbs, you can go ahead with your one cereal, then you can increase the quantity, but just do not focus on only one. Do not just add on chapati only and vegetable because you are eating only one cereal. No, you have to add some fiber along with that. So you add on and increase that amount, but this ratio equal, cereals and protein, this ratio equal, keep equal. Okay, and it's better and advisable always to pre-plan your diet. You can batch cook your meals, or you can freeze. You can boil and fridge the vegetables, because if you have a very busy schedule, and if you don't have time, then you can do it like that. So but what is you may have confusion, or mostly people come to me and say that freezing is not good, all the nutrient get lost. No, we lose nutrients while we cook also, when we just frying, and even if it is saute, we do it on medium to high flame, the nutrient loss is there. So you can boil, cool, remove the moisture, and then you can freeze it in the refrigerator with a tight lid. The nutrients will be there. Okay, so you can use it. There is no harm in that. And now again, what I have been explaining about low glycemic index food. What is glycemic index? Glycemic index is a scale which shows you that how much, how quickly any food that you are consuming will give a spike on you and raise your blood sugar. Okay, whatever you are eating, how much it gets assimilated and give a reading. This is your sugar. Okay, so this is called as glycemic index, and low glycemic index mostly less than 55. Safety say 50 is good, but less than 55 is the criteria of low glycemic index food. And what are the good sources? Oats, beans, lentils, brown rice, all the proteins with husk, all the dals and legumes with husk. This all comes under low glycemic index foods. So you can easily include all these sources. Okay, one thing I would like to mention here, people are eating oats and they are mostly not aware about the classification of oats. There are some kinds, some categories of oats that are available in the market. So the best is steel cut oats because this is not further processed. So there is an apparatus by which oats has been, it's cut in a particular shape and that is available in the market, which is called steel cut. When it is further processed, it is further processed, rolled down. It is called rolled oats. That is also available in the market. So if you are eating oats or if you are selecting this food for you, always go for steel cut oats. Okay? Now you understand what is glycemic index. Now there's one more term that you should know, that is glycemic load. How you will calculate this glycemic load of the food. So I have given this formula. Glycemic load is whatever the glycemic index of the food and what is the carbs that you are taking in particular food. Multiply both this and divide it by 100. So this is the glycemic load scale. And low is 10 and high is 20 plus. So 10 to 20, that is the medium. Okay. Like glycemic index, less than 55 is low GI and less than 10 is low GL. Okay, so whenever the food or diet is planned by a dietitian or a diabetes educator, we take care of glycemic index and glycemic load of the food in your diet so that your sugar doesn't give spike in your blood. Okay, so this is what the mindful nutrition strategy that people follow. And I have seen people are now they themselves plan their diet mentioning glycemic index because they are so much into this. They have learned all this things. So learn all these things. So this is very good. So yes, give me a minute. I'm just putting on my charger. Okay. Okay. So I think I'm done with glycemic index and glycemic load, and now you have completely understood how you have to calculate, how you have to think mindfully that whatever you are going to eat or you are planning for the day, it should be low in glycemic index and should be low in glycemic load. That will help in planning your diet. Okay. Now, if you have your cheat meals today, suppose if you want to go out or dine out and eat, or you want to eat your cheat meals, that is completely okay. It's fine. You can eat, but these are some strategy that you have to keep in mind because you have to think mindfully. There is no escape. You have to think because you are on medication and no one wants your sugar levels to go high. Okay, so what is the best way? First and the best and the intelligent way is the portion control. If you're going out and want to eat some, say, tandoori roti or dal makhani or whatever, first is portion control, strict portion control. That is the intelligent way. Second, add fiber. That I had given you enough examples how to add fibers. Okay. Keep hydrating yourself. when you are about to start your meal, pre-meal you can have water, okay, or unsweetened drink you can. And after the food gets over, you can have your green tea also, okay? So that will also again help. And always start with your protein first. If in your diet there is only carbs and protein, always start with your protein, or in plate your majority, your the major food should be the protein rich, okay, and then comes to your carbs portion. And after the meal, just try to engage in walking, at least 15 minutes walking. That is pretty good, and it will help again to improve insulin sensitivity. So be active after your meal and do smart sweats. If you know that healthy meals, healthy choices are available, do your smart sweats. Now you know enough. You are diabetic, and you know your glycemic index and glycemic load, the food list. Then you can easily, swap your food smartly. Rice is good, or quinoa is good. You know, uh, paneer is good, or tofu is good. So you can easily swipe mindfully. Okay. And it's better to plan your day in advance, like how you do for your work, you do it for your meals also. Now, if you had taken extra fat, okay, in your office meal or just like that, you know that you have taken extra fat and carbs. So how to balance that? Again, add more fiber, add more protein, because protein will always boost the insulin sensitivity. So add that. And like in my previous slide I said, post meal walk, that helps a lot. So that do. And prioritize timing. See, if you had planned your diet and you want to have your cheat meals, put it in first half of the day, or uh, before sunset. Say the heaviest meal is your cheat meal. Eat it before sunset. Okay, then you will get the time to balance it. But if you want to eat cheat meals in dinner, then what you will do? Then you will plan your entire day from morning to evening with very small, controlled portion size of food. Okay, so first half or second half, either way. So that depends entirely on you how you are managing that. Okay, this actually works. You just follow it. Whatever I am just explaining it, you just follow it. I have a huge data where person comes and say this really works. So I'm very happy when they come to me and say this really works. That is why I have written all these hacks. These hacks are on my practical experience. When I come to them, I follow up them, and now I come to understand they have all the diabetic patients are easily monitoring their sugars level. That's the best thing to listen from them. So you also just follow that. It will only give you result and nothing else. Okay, what is mindful eating that we all talk about? Mindful eating, mindful eating. This is something directly linked to your spirituality. You can say spirituality is nothing, is not only to go and sit near the idol and do worship and all. Spirituality is when you eat food in a sane manner, and you follow some practices, some mindful practices. See, eating is also a process. It gives you the satiety, it gives you the energy, it gives you everything. It gives you, a freedom to think. It gives you pleasure, it gives you happiness, a different kind of emotions you get. So, why you should not follow mindful eating? It is one of the therapy. It comes under the therapy. There are workshops, there are activities have been done on this. So you should also start. I have key pointed few points. If you will start doing this will again will give you very good results. Okay, eat mindfully. When we say eat mindfully, eat slowly, chew your food. What we are doing, we are not chewing our food. This is the this is not a complaint. This is the reality. People don't chew their food. They just eat hurriedly because they have to go back to their workstation. They have to go back to their workstation. They have to go back to their meetings and all. So what you have to do is eat slowly. Give time to yourself. Okay, listen to your body. and stop when you are 80%. This 80% rule works a lot. Stop eating when you think that, okay, I am full. I'm not saying that uh, go with your different eat and you think I'm 80% and just stop it. You after following this practice for a week, say 2 weeks, you will understand what is the requirement of your body. So you will pack 80% of food only. This is something what I want to say. Okay. And prioritize low GI food and practice gratitude for every meal that you are able to eat. Okay. We are fortunate to get enough meal every day. Don't waste your food at your workplace cafeteria. Please. Okay. And the feeling of present is like how you are. You have to follow the rule of presentism at office. You have to present at your office. You have to be there. So why not while eating you are there? Why you are eating and thinking of about your the next day work, the meetings, about your boss, the colleagues, and all these things, the workplace politics and all. Be there, eat there, think good things only when you are eating, or just you and food, and that's it. Okay, and always encourage healthy food to your colleagues, to with your friends, in your family, with your friends in society, wherever you are. Just encourage healthy practices, healthy food choices. Okay, this is a practice I want you can follow right now with me also. This is called belly breathing. Um, take your all this hand, all the fingers straight like this. Put it on your belly, on both sides of your navel, and inhale. I will count 10, and you all do with me. Put the fingers like this. Close your eyes, and I am counting. Inhale and exhale. I'm counting. 1, 2, 3. Please close your eyes. 4, 5, 6, 7, 8, 9, 10. You can open your eyes. Thank you for all those who have joined me. This is called belly breathing. Now, whenever you think, you have had your cheat meals or you're not feeling like eating anything, you can do this. You can also do this to improve your digestion. This is one of the key practices that comes under mindful eating. This will also help. Please share it with your friends or someone who you think, who you care about. This will really help. Okay, and along with that, it's always the fitness part. Like how I said, diabetes is all about the triangle of medicine, diet, and your workout. Okay, so workout is one of the important factor in maintaining your blood sugar level. But what are the good time that you can? Again, you will come up with the same excuse that you don't get time. You have to take out time. How? You can do desk exercises. And believe me, no one going to, stop you there. You will say, I am a diabetic patient. I have to do this. This is your right. You have some workplace rules, like some principles are there. No one from HR is going to stop you. Okay. So do some lift, some stretches. You can do on chair yoga. You can do active commutes. When you are coming from your own vehicle, you park them. Try to use stairs. If you don't have any breathing issues, try to use more of the stairs. Walk. Do engage yourself in walking, taking steps, count your steps. Okay. Use your mobile phones, trackers, and then understand how much calories you have already burned. Even if you are maintaining good weight, you should engage in such activities. This will help in regulating your BMR. Okay. In lunchtime also you can have after your food you can have, like how I said, belly exercise. You can do more exercises are there. You can do that and dedicate if you're not able to, give everyday time, take out at least 3 days in a week where you can dedicate 30 minutes for your workout. That could be stretching, yoga, meditation, walk, anything. And that is for your stress management. That is the need of the hour. You have to. Not today, tomorrow you have to. So start following that, and start it as a, as your routine. You have to do. What should be the ideal food shopping list? This is, I have mentioned in two categories. These are the essentials, and these are the GLUT4 activation. GLUT4 that I had mentioned, that is glucose transporter. So these are the food sources. Other than that, these sources, if you want personally, you can directly contact with team IMT Care. They will connect you to me, or either you can email me directly. I will mention more of the sources, because some person have few food choices as per their religion, as per their activity level, as per their food choices, likings, and food practices. But these are the general lists that I had prepared. You can take a screenshot. Okay. Okay, now coming to the most important part, myths and facts. Do not just listen to anyone, and especially those who are not diabetic, but giving other gyans on how to control diabetes. So these are the myths that medication means now you have failed. Now you cannot manage your diabetes. No, it's the part of effective treatment, and it's not a sign of failure. When you follow this triangle that I say, your diet, exercise, and medication, if you follow this triangle, your blood sugar will be maintained. Diabetics cannot eat rice or potatoes every day. You can. When you put steamed rice in your refrigerator for 24 hours, and next day when you take out that rice, heat it, you can easily eat it. That rice has low glycemic index. Similarly, if you boil potatoes, put it in the fridge, other day you use it, the glycemic index will be low. So that way you can use rice or potatoes. Portion controlled low glycemic index varieties like brown rice or sweet potato. See, these are the food that comes under low glycemic index food. So any food that comes under low glycemic index food, you can easily use. Again, frozen vegetables or frozen foods are not good for diabetes. Frozen packaged foods are not good for any, but frozen vegetables that you had just boiled and freezed it, you can use that. That has no much nutrient loss is not there, so you can use it. Okay. And yes, most of the people come up with the one big solution that I have started with bitter gourd juice, Karela juice. Now my diabetes will be maintained. No, dear. It is not the only factor that will help manage your sugar level. Okay. Coconut water you can easily have, but again, portion control size half cup, that is up to 120 ml you can have. Spicy food also you can have. Okay, there is no problem with that. Turmeric, cinnamon, chilies, these are anti-inflammatory food lists. So these things you can always include in your. I think I am done. If anyone has any question, please
There are
ask.
questions in the chat box, Smriti, if you can see. Are you able to see?
Just
Or should I read out to you?
yeah. So desi ghee is good or bad? No harm. Okay, it's a very good question and very debatable question. Desi ghee is perfectly fine. Up to 1 teaspoon of ghee you should include in your diet, because this comes under desi cow ghee you should use. Okay, and A2 I will recommend, because that is rich in that is good fat, and this fat help you in the absorption of vitamin A, D, E, K that is required. So desi ghee is always yes. Is gluten available? Generally use protein sources like white meat, egg, and pulses. See, egg and pulses are very good. white meat also, but I recommend eggs and pulses for good food. There are some supplements also available in the market, but once you start following, um, having more of the pulses in your diet, or if you eat eggs in your diet, that these sources will these sources are rich in good food. So this will anyway, these are helpful. Hi, I have two queries. In the meal composition, there is nothing mentioned about fat percentage. Two, the recording will be shared. The recording will be
The recording will be available to you in
okay.
a few days on the IMT Care
Yeah.
YouTube channel.
And for what I was what is his name? I don't know. See, I was explaining about carbohydrate distribution. Carbohydrate has the major role in impacting your blood sugar and protein. So I had in this presentation, I had only focused on the food that actually and directly impacting your blood sugar. Fat is entirely a different topic. It's entirely a different topic. Maybe if IMT invite me again, I'll make a different presentation on that. So I had not covered that food group. So I'm so sorry you didn't able to see that. Next question from come. Is glucose monitoring patches useful and essential? Yes, it is. It is. It is essential. If you are not, if you're not giving much attention to your food or your diet, then it is more important. Next question is from Imam. I'm sorry if I'm not able to I'm not able to pronounce your name properly. What should be the best form of ragi? Yes, it's a very good question. Ragi, you can have ragi in porridge form or ragi flour. You can make chapati. These are the best form. The less processed, better it is. Next question from Abhishek is how much milk or milk products can be consumed in a day? So it's a very, very good question, but this is something that cannot be, just the answer shouldn't be like just like this much or that much. Milk comes under protein category, and if a person is diabetic, I have to calculate how much protein he is taking. Accordingly, I will give this much of milk you can take. But one standard serving is 120, 120 half cup, or the big cup is up to 250 ml. So that is very safe. You can have that. That is very safe. But if I have come across some person who are taking thrice milk, one morning, evening, and then post dinner. So that is not. If you are taking that along with that, you have to take carbs so that equally it is distributed. And anyways, if you are only taking milk and majority of the times you are taking milk, it's good that you are taking enough calcium. But what about other nutrients? So in one line, if you're asking how much milk, there is no extra, or there is no higher limit, but 250 ml is a standard one big cup in a day. You can easily take safely, but make sure it should be low fat, and if it is A2, it's good. Preparing your meal plate. This is a question from Venkat. Preparing your meal plate before start eating helps in portion control. Just sharing my observation. Yes, it's a very nice nice observation, and it is very true. Your meal should be planned and strategized. You have to make strategy for that. Further question. Does diabetes cause frequent urination in weight loss? Yes, frequent urination is causing. That is one of the symptom of diabetes. And weight loss. When you start medication, and over the time, eventually weight loss is there. It is seen. Food for weight gain for pre-diabetic people. First, why you are deciding that you need to you need to gain weight. This part, leave it to your doctor, your physician, your diabetes educator, or nutritionist. Okay. And when you're saying I want food for weight gain, um, we as a health professional, we have to assess. We have to do one clinical nutrition assessment, and accordingly we can plan. Food is a therapy. It's not a medicine that I can prescribe just like that. But it's a good question, Shiva. Thank you. Further questions? No.
There are some questions in the question and answer thing. Is it true that butterfly pea flowers tea reduce blood sugar? What are the millets that can be consumed?
Is it true that butterfly pea flower reduce blood sugar? See, I also promote this. I had made few posts on Instagram on that. The research has been confirmed that it helps. So it is one of the safe choices that you can use this. What are the millets that can be consumed for both blood sugar and blood pressure patients? See, bajra, ragi, these are the safe millets. But see, millets are very healthy. But when you start eating healthy foods in, more than what you require, I mean, when you increase your amount, that healthy things will again give a spike in your sugar. So go for the healthy things. Millet is good, but the portion control should be there. So if you're eating two chapati, I'm giving an example. If you're eating two chapati or you're eating millet chapati, take one millet chapati. That will be equals to two chapati. So healthy things, but in control portion will give you the good results. Unless if you will, start eating healthy things in more than the required amount, the spike will be double. Last question I'm taking. 6.6 HbA1c. This question is from Sridhar. Okay, 6.6 HbA1c is average for 3 months. It keeps changing based on what we take next 3 months. So it is a better way to measure it. See, 6.6 is that you have crossed your borderline. You need to control your diet so that it will help you to lower down HbA1c from 6. And people do that easily. Sridhar, I will just advise you to meet any diabetes educator or clinical dietitian or nutritionist to design your diet. Your HbA1c will come down. It will easily come down. Okay.
Yes.
I think all the questions are
all the questions are done. Thank you, Smriti, and thank you everyone for whoever joined. And they were very insightful questions, good questions actually. Helped a lot of people. And Smriti, it was a great
sorry,
session.
I'm interrupting. What I like the best part, according to me, in the presentation is the question round.
Correct. Yeah, that means, I mean, people are inquisitive about their health.
Yes.
They want to know about their health and
That means
everything around that. People are aware.
Yeah.
Correct. Okay, so yeah, thank you everyone. Thank you, Smriti. And yeah, have a great weekend. Have a great day, everyone. And yeah, be healthy. And if you want to get yourself tested, you can go to IMT app and you get a 50% off on all the tests you can do. So yeah, thank you and bye-bye.
Thank you.